Hey everybody, my name is Steve Olsen, physical therapist with 21st Century Rehab. And we're putting together short little videos of things people can do at home to stay active and healthy while they're staying at home to avoid the COVID-19 pandemic. So I'm going to be talking about balance. One thing we see a lot for people in physical therapy is people who are at risk of falling and balance. And one thing I've learned in my 17 years of treating people that a lot of times these problems with balance can be exacerbated when people are not as active as they normally are for whatever reason, whether it be a surgery, whether it be disease, whether it be whatever. And since we're all staying at home now, not getting out, not getting challenged by normal everyday activities, this is something that you can do at home to work on. And there's a simple test you can do, simple single leg balance test. This is something I found a lot of people can't do, even people who don't have any known balance issues. I've even had athletes who can't do it for the amount of time. So it's really simple to do. I'll show you here really quick. What you're going to do is get into a balanced position here. You're going to cross your arms across your chest. You're going to lift one leg up, and you're going to set a timer, and you're going to try to go for 30 seconds. If you lose, your arms come out to the side, or if you touch down, the timer stops. I would put a chair by you or do it in front of a counter so you do have something you can hold on to if you need to. The normal for that, you can see here on this chart, typically starts at 30 seconds for people anywhere from 20 to 50 years old. It starts to kind of go down and it goes all the way down to 14 seconds for people in their 70s. I would say if you're not able to hold this for 5 seconds, this puts you at great risk for falling. And if you cannot do that, I suggest maybe contacting one of our clinics, speak with one of our therapists, maybe even set up a consultation of things you can do at home. But for right now, you can use this test as a simple exercise to do. So just like I was showing, what I would do is stand in front of something, counter, chair, so you have something close, trying to balance for 30 seconds as best you can. If you touch down, just kind of get right back up. Try to do that on each leg. I would suggest you try to do this 3 times a day. If you do that 3 times a day, every day for 2 weeks, you're certainly going to get better with this test. And it's definitely going to carry over to other balance activities. But again, if you have any questions, feel free to contact any of our therapists, any of our clinics. And I hope you all stay well. Thank you.